Hello, FTF crew. I'm John here, and I'm going to talk a little bit about gait today. So gait is a fancy term for walking, and a lot of the people that we see here often have a mobility limitation, which will lead to pain. So when you go to take a step forward, the first thing that you do is you come in contact with the ground on the heel, like so. So then as you're transitioning to that, it's called mid stance, or the middle part of the step forward, you are then setting yourself up to put force into the ground to push off of that big toe onto the next step. And that keeps getting repeated over and over and over again. So if you have mobility limitations in the knees, the ankles, hips, or anything else up the chain, really, if we can fix your gait, everything else up the chain should improve a little bit to a degree. And you're walking all the time, whether you do it recreationally or whether you're just trying to get from point A to B. And we want to make sure that that path from point A to B is as efficient as you possibly can. So proper gait pattern involves a little bit of opposite motion with the lead leg and the hand. So as you take a forward step, you should hit the heel first on the lateral side, because we're transitioning more to the middle of the foot as this hand is forward. And as you start to transition from the middle to the big toe, that's how you're putting force into the ground, like we said before, and pushing yourself into that next heel strike phase. And that's when this hand should be coming forward too, like so. I mean, I'm exaggerating it to show you a visual effect, but ideally, you're coming from outside to inside with that opposite arm swing. So if you're looking to improve your walking pattern at home, I don't want you to think step on the lateral side of the heel, midfoot, big toe. None of that. There has been studies that shown that that's just going to mess you up more. The best way to improve your gait cycle is just to focus on swinging your arms a little exaggerated, if you will. One real life example that I have to share with you is I have one client that's he's smushed like a pancake. He's compressed front to back this way. So his center of gravity isn't here like a cylinder, it's more pushed out to the side. So when your center of mass is pushed out more to the side, it's hard for you to alternate and reciprocate forward, like so. So he almost walks like a refrigerator, because he's so out here versus being this way. So one of the main things that we work on, or that I work on with him, is I have him do ankle mobility stuff to strengthen the front of his shin, because if you're always in your toes, your calves are going to get really tight because you're kind of walking in a plantar flexed position. So one way to down tick calf tone is to increase tone in the opposite muscle. So if we work on getting this motion, your calves will loosen up, and that prepares you for that first step of gait. So if you're here, this is one of my favorites to increase ankle flexibility. You're going to have this bar right across the bridge of your toes, and you're keeping your knees relatively straight. You can have a little bend, but preferably they're straight. So you're going to pull your toes back to your shins, feel the front of the shin engage, and then control that on the way down for a count of 2 to 3, and then squeeze back up. Because as you take a step forward, the anterior tib, the front of your shin, is responsible for controlling the deceleration from the heel strike to your foot being flat. So it's this to there. That's what it's largely responsible for. So you should take it slow on the way down intentionally. If you don't have access to a tib bar at home, we have a modification that works just the same. So we're going to slide in where you have a wall space. Feet are flat. You can pull your toes toward the shins, still keeping the knees relatively straight. Squeeze up, feel the squeeze, control that on the way down, and repeat. The further away, the harder it's going to be. The closer you are to the wall, the easier it will be. And even if you are this far away, it's still worth doing. I would do maybe 2 sets of 20 before you go on a walk, and just kind of be aware of how it feels. It should feel different. To sum it up, if we can improve your ankle mobility, we will lessen the amount of pressure in the knees and the hips, and you will move more fluidly as you walk. Now today we just kind of scratched the surface and we gave you 2 tools to use on your own, but if you'd like more information in the future, please comment and subscribe to our channel. Thank you.
If you liked this video, make sure to like and subscribe to our YouTube channel and follow us on social media. You can also check out our website. All links to our social media and our website are in the description box.